The role of organizations like R4D and CHMI is really to support strong domestic organizations like the African Capacity Alliance. They're doing really critical work on the ground here in Kenya to bring the right stakeholders together to form new partnerships in achieving the Sustainable Development Goals.
We have been partnering with the Africa Capacity Alliance, formerly the Regional Aid Trading Network, in strengthening the capacity of local Kenyan civil society organizations to manage their institutions and increase the impact of the services they provide in the health sector.
This is our first time supporting health PPPs in Kenya through these partnership workshops. We're also doing similar work across India in the states of Rajasthan and Andhra Pradesh, and working in Nigeria, Pakistan, and South Africa as well.
There are a number of areas where we have worked through public-private partnerships, working with the private sector. Probably with my current organization, Management Sciences for Health, in the area of leadership management and governance. But also in my previous work where we have worked with the banking institutions to improve access to a number of health services.
What motivated us to support PPPs was really driven by our partner organizations such as the African Capacity Alliance. We've worked with partner organizations on the ground for a number of years in supporting private providers or innovators to achieve scale. And what we were finding through the work with our partners is that working one-on-one with innovators themselves, there's only so much we can really do. The real goal needs to be to connect them to government financing for the public provision of private care.
What motivates us is the opportunity to partner and increase impact when you work within a partnership. But also, we are very much motivated by the cross-learning that takes place in a public-private partnership, whereby the private sector brings in its best and the public sector brings in its best. And together, you learn from each other. At the end of the day, you maximize the impact of the community.
I think what we're seeing in places like Kenya is a real enthusiasm and a real excitement for health innovation. But a lack of coordination to bring all of these different actors together. Innovators often work in silos. They don't even know their peer organizations. They oftentimes struggle to find connections to policymakers or donors to achieve scale. And so what we're trying to do is really bring all of these various stakeholders together to work together for common health outcomes and achieve national level health priorities in Kenya.
Looking to the future with all these opportunities that have been created is where I see the direction. I think that is where we all have to go. When you look at countries that are developed, that have maximized the impact of public-private partnerships, you can see that the benefit to the communities has been great. And that's where we see Kenya going.